RAAS is a multifactorial control system working to control blood pressure and volume. There are four main steps that occur to produce angiotensin II: RAAS activation, renin release, conversion of angiotensinogen to angiotensin I using renin, and conversion of angiotensin I to angiotensin II using angiotensin-converting enzyme. Let us delve into the five effects of angiotensin in the body. First is the vasoconstriction. Since angiotensin II is a potent vasoconstrictor, it causes narrowing or constriction of blood vessels when then increase the blood pressure. This effect is rapid and takes a few minutes. Second one is vasopressin or antidiuretic hormone release. The posterior pituitary releases antidiuretic hormone in response to angiotensin II. Vasopressin has two main effects: increase the peripheral vascular resistance and increase the water reabsorption from the kidneys. Blood pressure will rise as a result of both of these impacts. Third is that it directly acts on kidneys to reabsorb sodium and fluid, afferent arterial constriction. Angiotensin II operates directly on the kidneys to reabsorb sodium by stimulating the sodium ion and hydrogen ion channels in the proximal tubule. In order to maintain acceptable GFR, it also constricts afferent arterioles in the kidney. This will result in less plasma fluid downstream on the afferent arterioles, increasing sodium and fluid reabsorption from the renal tubules even more. Fourth one is aldosterone release. In addition to the release of vasopressin from the posterior pituitary gland, angiotensin II also causes aldosterone release from the adrenal cortex. Aldosterone acts on the distal renal tubule to reabsorb water and sodium, thereby increasing blood volume and blood pressure. Lastly is the increased sympathetic outflow. Angiotensin II boosts sympathetic activity. It acts centrally to promote sympathetic outflow and peripherally to facilitate sympathetic response on the sympathetic ganglia and adrenal medulla. Therefore, if there is a decrease in blood pressure, renal perfusion, sodium chloride, and decreased glomerular filtration rate, the RAAS will be activated wherein angiotensin II would exhibit those effects.